Well, this is such a wonderful thing that bats do. You think, well, can't we actually use that for something ourselves? And well, yes, ultrasound and sending pulses of sound and getting reflection and getting information about space and about nature is something that's done. And you may be familiar with this from pictures of unborn babies. But actually, medicine has moved on much further than that. And just as you saw with the wave machine, when I had to make very quick oscillations to send a very short pulse to actually be able to distinguish the length of time taken for that pulse to come back, and therefore the distance to that wall. If you're going to look at very small distances inside the body, you're going to need very, very short pulses. I'm very pleased that we've been able to get, especially for this show, Dr. Dan Reinstein from Cornell University, who's an eye surgeon who uses these techniques during surgery on the eye. Dan.
Hi, Neil.
Thank you very much for coming all this way.
Thank you.
Dan, what have you brought on?
Well, we've brought here, this is a laboratory tool, but believe it or not, we use it on patients. And what it is an ultrasound scanner that works at very high frequencies. So the pulses are incredibly short, and they allow us to measure tiny structures within the eye.
And Dan, is there something you could demonstrate with this now to show us the technique?
We could demonstrate your eye if you like.
I think I'd like to see it work first. Have you got something else that you can demonstrate it on?
Well, I was just joking. We did think of something, and we thought that actually these sugar-coated chocolate beans resemble an eye, or at least the very, very front of an eye. So what we're going to do is we're going to try and do that.
So you're filling up a bowl with water because that
right.
helps the pulses pass through.
That's right. We use the water to transmit the pulses to the bean and back.
Well, let's see your bean in action, Dan.
That's right. Thank you very much. So let's see. Now what we're going to look at here is this is a trace with nothing in front of the transducer. But if I take a bean and we put it down in front of the transducer, which will lower into the water. Here we go. And bean goes there. And we're going to find it now. Let's put it in range. There we go. So now we have an echo. You can see on the screen there an echo coming directly from the beam.
Very much like we had the pulse reflecting from the wall.
Exactly the same, but on a very small scale. Now, what I'm going to do, this is a stationary pulse, and what I'm going to do is I'm going to move the transducer in an arc, and what this is going to do is it's basically going to scan the beam. Now that's giving us an image on the screen of the surface of the beam. And if we freeze that, that's the image. The image is over here on the left. And what we can do is save that right there, and we will quit out of this program and measure things. Because what was of particular interest to us, I think, was to know just how thick the sugar coating is.
Well, it's always of interest to everyone.
This was the big question.
Who buys sugar-coated chocolate beans.
Yes,
exactly.
Absolutely. And really, you have to do this before you eat them, because in these calorie-conscious days. So there's the surface of the bean, and we're now going to place the cursor out here, and we're going to select an area to measure from, like this. And there we go. And we get a trace. Now the trace, here's the big echo. That's the loudest one. It comes from the front surface. And the second one is there. And that comes 72 microns further back.
So 72 microns, that's 72 millionths of a meter.
That's right. It's not very many calories.
Right. And so how does this help you, Dan, with eye surgery? Because presumably you don't spend your day
Well, unless the patient has eaten a bean.
Measuring beans.
But in general, what we do is we use this to look at the structures of the eye. And I think we have a model over here, which I will show. And just place this here. You see, this is a plastic model of the eye. The eye is like a camera, and there's a film at the back, and there's some lenses at the front. And what we're interested in, of course, for eye surgery to correct vision so that we don't need glasses, this is a new thing that we're doing with lasers, is the cornea, which is the front lens of the eye. And so, as you can see, this front section of the eye can be scanned by our scanner to give an ultrasonic image of the very detailed small structures within the eye.
I think this is a oldish model because you can't actually see any of the features really of the front layers. So this must be quite new stuff.
Actually, yes. It's only been, we've only measured this about 7 years ago was when we first did it. And until then, it was thought that the individual layers of the cornea were not important to measure. We now know that they're extremely important.
Well, that's very interesting. And how does this help you actually during the surgery?
Right. Well, we have a little footage of the way that we scan patients before we start. And you'll see here, this is taken actually in pitch darkness, so we're using an infrared camera. And as you see, we've got a patient lying under in a water bath, and the scanner is moving across the eye and taking different cross sections. Now, after we've done this, we make particular measurements, and we use a laser. You can hear it. That's the laser pulsing and taking very, very small amounts of tissue from the cornea to reshape it, recontour it.
And this is helping you actually improve the safety and precision of the surgery.
Well, exactly. In fact, I've got a couple of images here to show that. These are this is the same cornea, but this is the scan taken before surgery, and this is the scan taken after surgery. And you can see that at the level at which the laser was acting, there's now an extra third line within the substance of the cornea. And the distances from the front to that line and others are being used now to improve what is already a very accurate procedure into an even better
That's
surgery.
wonderful. And the key to this was time, because it was short time pulses of sound that help you guide the surgery, which uses short time pulses of laser light.
Everything. Yes.
Well, thank you very much, Dan, for showing us that. Thank you. So we've seen bat